Hello and welcome to the Language Clinic channel. We are going to talk about panic disorder. What is panic disorder? The history of panic disorder, epidemiology of panic disorder, comorbidity of panic disorder, uh, etiology of panic disorder like biological factors that cause panic disorder, panic-inducing substances that can cause panic disorder, and brain imaging, which can also cause panic disorder. Mitral valve prolapse can also cause chronic panic disorder, and some genetic factors which can also cause panic disorder, psychosocial factors, and so on. So, what is panic disorder? Panic disorder is an acute, intense attack of anxiety accompanied by feelings of impending doom, is known as panic disorder. The anxiety is characterized by discrete periods of intense fear that can vary from several attacks during one day to only a few attacks during a year. Patients with panic disorder present with a number of comorbid conditions, most commonly agoraphobia, which refers to a fear of or anxiety regarding places from which escape might be difficult. Now let's talk about the history of panic disorder. The idea of panic disorder may have its roots in the concept of irritable heart syndrome, which the physician Jacob Mendes da Costa, who was born in 1833 and died in 1900. This physician, Jacob Mendes da Costa, noted in soldiers in the American Civil War. Da Costa's syndrome included many psychological and somatic symptoms that have since been included among the diagnostic criteria for panic disorder. In 1895, Sigmund Freud introduced the concept of anxiety neurosis, consisting of acute and chronic psychological and somatic symptoms. Now let's talk about the epidemiology of panic disorder. The lifetime prevalence of panic disorder is in the 1 to 4% range, with 6 months prevalence approximately 0.5 to 1.0% and 3 to 5.6% for panic attacks. Women are 2 to 3 times more likely to be affected than men, although underdiagnosis of panic disorder in men may contribute to the skewed distribution. The differences among Hispanics, whites, and blacks are few. The only social factor identified as contributing to the development of panic disorder is a recent history of divorce or separation. Panic disorder most commonly develops in young adulthood. The mean age of presentation is about 25 years. But both panic disorder and agoraphobia can develop at any age. Panic disorder has been reported in children and adolescents, and it is probably underdiagnosed in these age groups. Now let's talk about the comorbidity of panic disorder. Of patients with panic disorder, 91% have at least one other psychiatric disorder. About one third of persons with panic disorders have major depressive disorder before onset. About two thirds first experience panic disorder during or after the onset of major depression. Other disorders also commonly occur in persons with panic disorder. Persons with panic disorder, 15 to 30% also have social anxiety or social phobia. 2 to 20% have specific phobia. 15 to 30% have generalized anxiety disorder. 2 to 10% have PTSD or post-traumatic stress disorder, and up to 30% have OCD or obsessive compulsive disorder. Other common comorbid conditions are hypochondriasis or illness anxiety disorder, personality disorders, and substance related disorders. So that's all about panic disorder, about the history, epidemiology, and comorbidity of panic disorder. If you like the video, please subscribe to this channel. Thank you for watching.